Good morning, afternoon, and evening, everyone. My name is Mark Canavera. I'm the Associate Director of the Care and Protection of Children, or CPC, Learning Network, whose secretariat is housed at Columbia University. We're very excited to see so many people here today, and we're going to wait just another minute or two for people to join us before we start the webinar. Good morning, good afternoon, good evening, depending on where in the world this webinar finds you. My name is Mark Canavera of the Care and Protection of Children, or CPC Learning Network. We are delighted to see so many people who have signed up for this webinar. We had 150 registrants and several thousand people who viewed the announcement on social media, so we know that this is a topic that generates a lot of interest. And before going further, I would mention that this webinar is being recorded so that the recording of this presentation can serve as a reference and a resource for people who aren't able to attend the webinar live and in person with us today. We have an all-star lineup of speakers today. The CPC Learning Network has the great pleasure and privilege of co-leading the INSPIRE working group with the World Health Organization. And two of the people that we're going to hear from today during this presentation are representing the World Health Organization. Dr. Alex Butchart is the Prevention of Violence Coordinator at the World Health Organization in Geneva, Switzerland. His responsibilities include coordinating the global campaign for violence prevention, the development of policy for the prevention of interpersonal violence, the preparation of guidelines for the prevention of specific types of interpersonal violence, and the coordination of research on interpersonal violence and its prevention. Dr. Butchart trained in clinical neuropsychology and public health. Prior to joining the World Health Organization, he worked mainly in Southern and East Africa, where he was lead scientist in the South African Violence and Injury Surveillance Consortium, and in collaboration with the Uganda-based Injury Prevention Initiative for Africa, helped to train violence and injury prevention workers from a number of African countries. Joining Alex and myself will be two others, Sabine Rakoto-Malala, who is Dutch and Swiss and seconded by the Swiss Development Corporation to the Secretariat of the Global Partnership to End Violence Against Children. Put more briefly, End Violence. Sabine has an MD in child psychology from the University of Utrecht in the Netherlands. After starting her career with the World Health Organization in 2002, she joined Terre des Hommes in 2005 to support programs on violence against children and psychosocial distress in both humanitarian and development settings. In 2013, she joined UNICEF as the Deputy Coordinator of the Child Protection Working Group. Ms. Rakoto-Malala rejoined the World Health Organization's Department for Management of Non-Communicable Diseases, Disability, Violence and Injury Prevention, the Prevention of Violence Unit, in May 2016 as a technical officer. Her work consists of bringing together key partners from different sectors around the prevention of violence against children to support pathfinding countries in their efforts to scale up violence prevention efforts, to ensure the dissemination and implementation of the INSPIRE package that we'll hear about today, these 7 strategies to end violence against children, and to raise funds for the sector, as well as supporting the executive committee of the global partnership. Finally, covering the question and answer component, it will be Beth Rubenstein, a colleague of mine who's a senior research associate with the CPC Learning Network. Beth is passionate about working at the intersection of global health research and practice. Her current projects include developing methods to estimate the scale of children who are separated from their families during humanitarian emergencies, generating evidence to inform community interventions aimed at reducing interpersonal household violence, and evaluating the long-term impacts of large-scale social protection programs. Beth holds a Master of Public Health and a Master of Business Administration from Johns Hopkins University and is currently a PhD candidate in Columbia University's Department of Epidemiology. She has over 10 years of applied experience in global health and human rights, including the prevention of international child trafficking, health systems equity in Ghana and Rwanda, and HIV treatment access activism in South Africa. Beth also previously served as a Peace Corps volunteer in Madagascar, focusing on health and nutrition at the community level. We will hear from them in that order after I have done a very brief overview of the Inspire package. This really is intended to be an introductory webinar. For those who are not familiar with the Inspire package, and will be followed by additional webinars that will go into more depth. I've already mentioned that it will be recorded and available on our YouTube channel. And I would add that if you have questions for us, we will have a relatively lengthy question and answer period at the end, hopefully at least 30 minutes. We hope for the whole webinar to take somewhere between an hour and 15 minutes, depending on people's interest level and their level of questions. But Beth will be overseeing that. You can type your questions into the chat box and those will reach us, so please don't hesitate to do that. So to get into the meat of what we're talking about here, the Inspire package, which you may have heard of, was designed to be to gather and collate the currently known evidence about what works to prevent and reduce violence against children. It was designed in line with Sustainable Development Target 16.2, which is to end abuse, exploitation, trafficking, and all forms of violence against children. I think a number of you on the call have been involved in efforts to advocate for this development target, which was seen as a huge boost and improvement over previous efforts to consolidate what is known and what we can do to end violence against children. Since its publication in July 2016, the World Health Organization and 9 other agencies listed here have joined forces in advocating for and supporting the implementation of Inspire, 7 strategies for ending violence against children, as the means by which to achieve this goal. These 10 organizations together are frequently called the core members, and we have joined them and will be joined soon by another civil society organization. Inspire is available in all 6 official United Nations languages and is likely to be translated into several others. So what are you seeing?
Yeah, Mark, the slides are not moving.
Okay, thank you. I'm getting notes here that I'm not in presenter mode. Let's see, how is that?
That's the slide that you were speaking about.
All right, well, let me back up very briefly then. Here are the 9 organizations that came together, the 10 organizations that came together to advocate for the development and implementation of the Inspire working group. And here are the 6 United Nations languages in which Inspire is currently available, with more to be expected. Each letter of the word Inspire stands for one of the 7 evidence-based strategies. And what you're going to hear about from Dr. Butchart is what evidence we have been able to collate according to a set of predetermined criteria for each one of these strategies. I is for the implementation of and enforcement of laws. N is for changing norms and values around violence against children and its drivers. S is for creating and sustaining safe environments. P is for parental and caregiver support. I is for income and economic strengthening. R is for the response services needed when children unfortunately become victims or survivors of violence. And E is for the known education and life skills interventions that have been demonstrated to reduce violence against children. The INSPIRE vision is that governments everywhere, working closely with civil society partners, will routinely implement and monitor interventions from each of the 7 INSPIRE strategies to prevent violence and enable children to reach their full potential. The types of violence covered by INSPIRE are child maltreatment, most often, as we know, at the hands of parents and caregivers, bullying and youth violence, which is typically between peers, intimate partner violence, also known as dating violence, sexual violence, and finally emotional or psychological violence and the witnessing of violence. While we have listed these separately, each type of violence can co-occur with other types, and being a victim of one type of violence can increase the likelihood of involvement in other types of violence later in life. To highlight the importance of addressing violence against children, the INSPIRE document provides prevalence estimates showing that up to 1 billion children, or every second child, will experience some type of violence each year. You can see on this slide some of the different forms of violence that we have been able to collate the statistics from. In addition to homicide, which is a leading cause of death among adolescents, non-fatal violence against children has many acute and lifelong health consequences, including injuries, non-communicable diseases such as cancers, cardiovascular disease, and diabetes, communicable diseases such as HIV, maternal and child health problems, and mental health problems. As such, violence against children is a significant problem in itself and major risk factor for many priority public health conditions. 2/3 of the INSPIRE core document focus on prevention and response strategies. For each of the 7 strategies, examples of specific interventions by which they have been implemented, by which the strategies have been implemented, are provided, along with evidence supporting the interventions and links to the SDG targets that each strategy will impact. There is also a section on cross-cutting components that covers the multi-sectoral actions required to implement all 7 strategies and highlights the importance of monitoring and evaluation, intervention, uptake, and effectiveness. A final section provides an overview of issues to consider around implementation, such as program adaptation and fidelity, which are more fully dealt with in an accompanying implementation handbook that Sabine will describe later. This slide shows how the 7 strategies each include 3 to 5 specific interventions in the approach section, the sectors typically involved in their delivery, and the cross-cutting components of the strategies. And Dr. Butchart will return to each of these in his section of the presentation. The INSPIRE strategies include 6 focused upon preventing violence before it occurs through interventions delivered to entire populations, regardless of differences in risk, or targeted to specific subgroups that are at heightened risk. The response and support strategy includes interventions designed to prevent revictimization and further perpetration, impairment, and long-term outcomes. Dr. Butchart will now describe some of the evidence for effectiveness included in support of the INSPIRE strategies. Over to you, Alex.
Thanks very much, Mark, and good morning, good afternoon, good evening to everybody on the webinar. As Mark said, I'll run through some of the evidence that INSPIRE has brought together for each of the strategies, beginning with the strategy on laws. And that strategy includes, among the laws, those covering the banning of violent punishment, laws criminalizing sexual abuse and the exploitation of children, and laws that prevent particularly important risk factors, in this instance, alcohol misuse and access to firearms and other weapons. Mark, if you could move the slide. So just one example of the evidence that is included there is shown here. And this has to do with the introduction and the enforcement in South Africa of the Firearms Control Act, which resulted in the saving of around 4,500 lives, including many adolescents, across 5 years in South Africa's 5 biggest cities. Mark, next slide. So the next strategy has to do with strengthening norms and values that support non-violent relationships. And this involves modifying the idea that some forms of violence are normal and even justifiable. And the kind of programs or approaches included here are programs that change adherence to restrictive and harmful gender and social norms, community mobilization programs to encourage people to adopt pro-social, gender equitable attitudes, and bystander interventions to encourage people to say no when they see violence, for instance, towards girls or women taking place, and intervening to try and stop it. Next slide, please, Mark. Children's witnessing of domestic violence between parents is one of the ways by which such violence is normalized, and it increases the chances that they will grow up to use such violence themselves. And interventions that can prevent intimate partner violence are thus important in preventing violence against children. The example here, SASA, is a community mobilization program that was developed in Uganda and was found to reduce intimate partner violence by 52% and is estimated to have reduced the proportion of children who witnessed such violence by 2/3. Mark, next slide. Moving to the safe environment strategy, this is focused on modifying the social and the physical environment through which people move and in which they live and work, with the aim of fostering positive behaviors and deterring harmful ones. Promising approaches here include interventions to address community violence by addressing hotspots, interrupting the spread of violence, and improving the built environment. Next slide, please, Mark. The example we've given comes from Cardiff in the UK, but is also being piloted in other parts of the world, including South Africa and Australia. And this was called the Cardiff model, and it aimed to address hotspots for violence by pooling anonymized information from hospital emergency departments and from the police to better identify these hotspots for violence, such as bars, clubs, and other gathering places where older children and youth get together, then intervening to reduce the risk factors in those settings. And this was found to reduce violence-related injuries seen in hospital by 42% and police-recorded woundings by 32%. And it saved £82 for each pound spent on the intervention. Mark, next slide. The parent and caregiver support strategy aims to reduce harsh parenting practices and create positive parent-child relationships. Support can be delivered through home visiting or in groups where parents are educated about their children's development and trained to adopt positive parenting practices. Next slide, please, Mark. So examples of effective interventions given in Inspire include the well-known program, the Nurse-Family Partnership, developed by David Olds in the USA, which showed a 48% reduction in child maltreatment. And, next slide, please, Mark. The far more recently developed suite of programs known as Parenting for Lifelong Health, which is a set of group-based parenting support programs developed in South Africa and now being trialed in between 10 and 15 other countries that have been shown to reduce child abuse and to increase positive parenting. Next slide, please, Mark. With the goal of improving families' economic security and stability and reducing child maltreatment and intimate partner violence, income and economic strengthening entails providing cash transfers in combination with parent training or on condition that parents or caregivers ensure that their children attend school or by providing microfinance in combination with education for men and women on things such as gender norms, domestic violence, and sexuality. Next slide, please, Mark. By way of example, INSPIRE includes the intervention with microfinance for AIDS and gender equity, better known as IMAGE, which combines microfinance with education on HIV, gender norms, domestic violence, and sexuality. And the trial of this in rural South Africa found that it introduced intimate partner violence by half among women in villages that received the intervention compared to those in villages that didn't. And as we noted earlier, this will also have reduced the proportion of children witnessing domestic violence, and with that, the likelihood of their subsequent involvement in violence. Next slide, please, Mark. So children who have experienced violence, either as perpetrators or as victims, need access to good quality health, social welfare, and criminal justice support services. And these can help to break the cycle of violence in their lives and help those children to better cope and recover. Trauma, so in this strategy, we include several groups of approaches, such as counseling and therapeutic approaches, screening combined with interventions, treatment programs for juvenile offenders in the criminal justice system, and foster care interventions involving social welfare services. Next slide, please, Mark. By way of example, a systematic review of hundreds of life and social skills training programs found that they reduced aggressive and disruptive behavior among children in school settings by 25, excuse me. I'm going to go back up on that. Right. So the example that we've given here is of trauma-informed cognitive behavior therapy for children that have experienced violence, and a systematic review of 11 trials found that this reduced trauma symptoms and functional impairment among children and adolescents exposed to violence by 37% when delivered to individuals, and by over half when delivered in a group format. Mark, next slide, please. The presentation is now catching up with me. The education and life skills strategy stands for, is premised on the idea that gains in education can protect against victimization and the perpetration of violence. And it thus involves approaches such as increasing enrollment in preschool, primary and secondary schools, improving children's knowledge about sexual abuse and how to protect themselves against it, and providing life and social skills training. Mark, next slide, please. And so here we are with the example. I got onto it a little too early just now. It's the example of education and life skills, and a recent systematic review found that these programs reduced aggressive and disruptive behavior in school settings by a quarter when delivered to all students, regardless of risk, and by a third when targeted to selected high-risk students. And in addition to these kind of findings, INSPIRE also includes examples such as the Good Schools Toolkit, which was trialed in Uganda and found to be very effective in reducing violence both by teachers towards pupils and among school-going pupils themselves. So that's a very, very brief tour of just some of the evidence included in INSPIRE under each of the strategies, and you're encouraged to go into the core document itself to see more about it. I'll now hand back to Mark, who I think is going to introduce Sabine.
Thank you, Alex, and thank you, Mark. So the first time that I saw INSPIRE, I thought, wow, what a gem, what a huge resource. And then my second thought was, great, now how are we going to implement it? And what do we do with all this information? And I'm sure that there's, I think, some 60 people on the line now, and you're probably all thinking the same thing. But we've thought about this, and as you know, INSPIRE was launched about 18 months ago, and very quickly we set up an INSPIRE working group to start figuring out, okay, now that we have this tool, how are we going actually to get it out to the frontline workers that are doing the hard work? So we agreed as a group to develop what we are now calling the INSPIRE Implementation Handbook. The idea is to make a cookbook, something so simple that any frontline work or a project planner can implement Inspire. I think two huge things that I found very interesting in Inspire, or there was a big shift, was the first one is the focus on prevention. I think most of the tools that we see out there are very much focused on response, and as Mark said, 2/3 of Inspire is pretty much on the prevention side, and the second is on the multi-sectoral side. So often the health sector doesn't understand the justice sector doesn't understand what the social services sector is working on, and the idea of this Inspire handbook is really to help all the sectors understand each other, and for those that are working on the response sector, in the response area, to focus more on prevention and to understand what it actually means to implement a school-based violence prevention program, or how you develop a social norms intervention, or how you do a parenting program. So that's really the objective of the implementation handbook. You can jump to the next slide, Mark. Yeah. So you'll see the Inspire Implementation Handbook is being developed by a company that's working with us, and they did a very interesting approach. They actually started by interviewing end users, and they said, what do you need? What do you want something like this to look like? So it's really about getting it to the right people in the right language. And then they did a lot of literature review, what was out there, all based on the existing language and programs that are in Inspire. And then they did a lot of expert interviews, so to those that are actually implementing these programs. So there's going to be 8 chapters. The first chapter gives an overview of what's multi-sectoral coordination about, what is prevention about, how do the different strategies work together, how do they affect each other, and then more globally, how the 7 following chapters will be linked. Then you have each of the 7 strategies. So for each of them, for each strategy, you have 1 chapter. And in there, you have really rich information on how much does the program cost? What do you need in terms of human resources? What are the potential outcomes? What are the barriers that you may face? And then also the examples of, even more broken down than what Alex just presented, a real breakdown of what are the core transferable elements of each intervention that you need to consider when you're going to implement it. We've even done a lot of work over the past 18 months on indicators to make sure that you can even measure whether your intervention is working or not. And that's been a huge effort, I think, amongst all this, again, amongst all the core agencies on agreeing on those indicators. There's a lot of integration of the humanitarian. How can Inspire be integrated in humanitarian settings or applied to humanitarian settings? So really the 7 chapters will be very rich of information for somebody in Sri Lanka that wants to implement a parenting program, or in Uganda that wants to implement a social norms program. It's basically a ready-made cookbook. Next slide. The idea is really, our vision is that organizations are going to start implementing Inspire. And what does that mean? It sounds so overwhelming. If you're a radio station in Bangladesh that wants to implement Inspire, you think, wow, how can I do this? But the idea is really that you see how you fit into the larger picture. So understanding that there are 7 strategies. So it could be that you're focusing at a country level on implementing 3 strategies in 2 geographical locations. It could be that at community level, there's implementation of all 7 strategies in 2 or 3 communities. It could be that the health sector says we need to focus on these 3 strategies. So the real aim is, again, I'm working for the Global Partnership and we have 14 pathfinding countries. What we're really hoping to see over the next 5, 6, 7 years, that there's a huge scale up of the 7 strategies and interventions within those strategies. And scaling up is not an easy thing. You need not only the funds, but also the technical expertise. And the idea of this handbook is to give you the technical expertise to be able to scale up these programs, at least in the 14 pathfinding countries, but ideally in countries around the world. And then the other important element of this is, of course, the monitoring of it. We need to start being clear on what's the theory of change when we implement an intervention, and then are we actually achieving success? And to do that, you need to evaluate at the beginning of the program, in the middle of the program, and after the intervention has taken place. So that's really what this handbook is pushing for. Next slide. and then you can click again, Mark. So the idea, of course, is that we see an increase, as I was just mentioning, of the 7 strategies throughout your agency's work, throughout your or within your country or within your district or province, at whatever level you're working. And then within that, of course, the assumption is that there will be a decrease in the prevalence of violence against children. Next and last slide. The Inspire working group is made up of about 80 organizations, about 120 people. We encourage you to join the Inspire working group so that you can be aware of things as they're evolving. But as I mentioned, we are really pushing for the promotion of Inspire in the violence against, in the global partnership Pathfinding Countries, and also the countries that are doing violence against children surveys. We are going to continue reporting on success of implementing Inspire. We're pushing for research on the implementation of the strategies. And then we hope to collect all this information for in 2-3 years' time to be able to update Inspire to include more of the evidence that's in there and more of the learnings that are in there. Over to Beth.
Hi, thanks. So that was a really great presentation, and we are just starting to get our first question in the Q&A box. We wanted to open up to everyone for questions. You can either raise your hand through the feature through your attendee box, or you can submit a written question. And the first question is from Jennifer Groves, and she asked, will the implementation handbook's humanitarian application be linked or reference the CPMS or other tools resources developed by the CP Alliance? And we have been in close communication with the Child Protection Alliance throughout the handbook development. Sabine, could you speak to specifically how it's been referenced? You know, they have been a big part of the user consultations.
Yeah, they're absolutely. So they're referenced throughout each of the 8 chapters of the handbook, actually. There's a reference to the Child Protection Minimum Standards. And also, we really acknowledge that in humanitarian settings, much of the work on violence against children is on family reunification, alternative care options, psychosocial distress, children in armed groups. And so that's really highlighted throughout the handbook in the relevant chapters. Maybe an important thing to add also before I get the question, something I should have added is, we're not saying that Inspire is a new, that what you've been doing is wrong. All we're trying to say is let's organize it in a way that we're all speaking the same language, that when that we are all considering the 7 strategies, but also let's stop reinventing the wheel. Let's start implementing programs that have the evidence that works. And that's applicable for development settings, but also humanitarian settings. And you will find, even in the Inspire original tool, that there are interventions that are completely applicable for humanitarian settings. And then we hope that in the handbook, we've managed to make those more accessible, and that we've managed to digest it in a way that somebody working in a humanitarian setting can actually implement this.
This is Mark, just to chime in on that piece as well. The CPC Learning Network participates both in the Alliance for Child Protection and Humanitarian Action and the Inspire Working Group, and we will be very involved in the process of revising the Child Protection Minimum Standards, so that as that process happens, we can look for ways to make sure that the language and the concepts begin to align with Inspire. And I think that process will help us to understand where misalignment or areas that are not yet considered, or one or the other document, the Child Protection Minimum Standards or Inspire, might need special consideration. So we're looking forward to that, and also hope once the implementation handbook that Sabine has mentioned is launched, to organize a series of consultations around Inspire's implementation in humanitarian settings. I also actually had some questions that I thought of as, I know that's not really fair, but as I was listening to Alex and Sabine present, I did want to ask Sabine to maybe provide presenters with a little bit more information on what a pathfinding country is. I'm not sure if all of our attendees will be aware of that, but maybe a little bit of history on that. And secondly, I'm not sure if this is useful in this setting, but some of the people on the participants may have heard of the Data to Action tool. And it might be useful for them to hear about that and how that aligns or doesn't with Inspire. So over to you, Sabine and Alex.
So yeah, thank you, Mark. Good point. For the pathfinding countries, so the global partnership, as you probably know, was launched 18 months ago with this idea of pathfinding countries, and it was quite opportunistic because some countries came to us really, and these included in the beginning Tanzania, Indonesia, Sweden, and Mexico, and they said, you know, we're doing quite a lot on this, and we're ready to show the way. And so we further developed the concept, and we realized there are some countries that are really doing wonderful work, that are at a national level developing national action plans, moving on data collection efforts, reallocating resources in their country, setting up strong multi-sectoral coordination groups. And so we currently have 13 of these countries, and they're all around the world, from Jamaica to Sri Lanka and Indonesia to Uganda, or Uganda not yet, but Tanzania, Sweden, Mexico, El Salvador. And they have to submit an expression of interest, which is sent to Tony Lake, the director of UNICEF, or to Susan Bissell, the director of the partnership, explaining what they are doing currently to end violence against children at national level and or subnational level, and what they intend to do to scale up their efforts. So some countries, we tell them, sorry, it's not good enough. You're not yet ready to be considered a pathfinding countries, but otherwise they're currently 13. There might be 20 in a year or 2 years' time. We don't want to have too many, because the idea is really to support them as much as possible in their efforts, and then to measure, to keep on tracking their progress, and to allow other countries to see what they're doing. So I think we're a small secretariat, there's only 9 of us. So if we would have 50 pathfinding countries, that wouldn't work. But you can find more information on our pathfinding countries on the End Violence website.
Okay, and so the Data to Action tool is something that is very complementary to the implementation handbook. It is also a work in progress at this point, but probably closer to being finalized, or as close to being finalized as the implementation handbook, being jointly developed by Together for Girls, UNICEF, CDC. And what it is a workshop tool that should be applied by countries that have completed a national survey on the prevalence of violence against children and its risk factors, by which they can understand what the findings mean for their planning of prevention and response strategies. So what it does is to systematically help, or it helps stakeholders to systematically understand findings from a survey, or in fact, if they have non-survey data, that kind of information, understand what it means for prevention, and through that, you do a step prior to Inspire. You say, okay, we do have interventions in relation to laws, but we're very weak on the parenting side. And it seems that our education and life skills programs, because they are focused on the wrong kind of violence, because most violence may, for instance, show up to be by peers or family members, and the life skills training is talking about stranger danger. So that kind of thing will then help stakeholders to orient themselves around the data in terms of where it points to what kind of prevention strategies should be implemented. They then move to the implementation handbook and can have a more fine-grained assessment of which interventions from within each strategy are best suited to their needs and to their resources. I believe that the Data to Action handbook should be ready quite soon, and we certainly do point to its value as being a kind of precursor to the implementation handbook in countries where there is sufficient data to justify its use.
Maybe just in terms of timeline, the aim is to have the Data to Action handbook and the Inspire handbook both ready for the End Violence Solutions Summit, which will be in February.
Great. We are now getting quite a few questions in the Q&A box. So let me start from the first question from Tamara Gorman, and she asks, at what scale does Inspire need to be implemented in order to have significant outreach? How will it be systematically scaled up and down vertically and horizontally? I think that's a great question, Tamara. And, you know, I put this in the chat box. I'm not sure if there's a clear formula to answer that question. So much is going to depend on context and resources. So I think, you know, there are different levels of scale that Inspire can be implemented in order to have impact, and we're not prescriptively defining that, you know, you need to implement it nationally. You know, some countries might want to try to implement it regionally, or, you know, in a few districts at the beginning. Some countries might want to focus on 1 or 2 strategies to begin with. Other countries may start with all 7. And, you know, I think that all of those approaches are being tried in various places around the world right now, and all of them are having different types of impact. And I think the key is just to monitor whatever it is that you do in your country, in your context, to track the efficacy of the effectiveness of that specific approach. Do others want to add to that?
No, I think you've summed it. I think you've summed it up really well. I mean, you could say at the sort of low end of the scale, the kind of numbers that were involved in some of the outcome evaluations that are cited in Inspire could be contemplated at an intervention. So it could be literally a few hundred people. You know, that's a large enough group of people to show benefits, for instance, of a program, or a few hundred families to show the benefits, for instance, of a parenting program, as long as you, Beth said, we monitor it very carefully. But of course, I think ideally one's thinking that the level of implementation would be at the municipal or district level. I think that would be the ideal level, although there's no reason not to go to a lower level and work with a smaller number of people, provided there is that monitoring in place.
Great. The next question is from Mandy Yamanis. Sorry if I mispronounced your last name there. And she asks, do any of the strategies include working with faith-based leaders, and do any of the strategies address online risks? So faith-based leaders have been, again, a core part of our user engagement, and they have we have definitely made outreach to faith-based groups in designing the implementation handbook. So hopefully, you know, that the implementation handbook will speak to that community. In terms of online risks, do others want to address that?
We're working on a document that's trying to map the work that We Protect is doing on online violence against Inspire. And we see that there's about an 80% overlap. And so basically, if you implement Inspire, you prevent the violence that you see online is also offline. And so about 80% of it is in Inspire. And now we need to add in the handbook, and I'm just questioning Alex on whether it's actually in there, but more on you know, looking at the images, working with Interpol, and those kind of the grooming that happens online, and whether we should be including that in the handbook. But it's definitely on our radar screen.
The next question is from Andrew Tameyer, and he asks, can you please provide a few example indicators to help answer the how do you know it's working question? And I don't know if we talked about this in detail during the presentation, but there is simultaneously been a huge effort made to develop indicators for evaluating Inspire and for monitoring Inspire, and those will be released as part of the implementation handbook, as well as in a separate document that goes into even more detail about how to measure each indicator. So we definitely recognize that part of giving people implementation guidance is also giving monitoring guidance. And again, quite a number of agencies have been involved in a process over the past year to select the best and most practical indicators for implementing agencies to use across all 7 strategies. And there's also a group of indicators that are more a cross-cutting level, because many of the strategies will have an impact at a cross-cutting level. Do others want to add to that?
I would just note, Beth, sorry, Alex, that we pointed out at the beginning that there were 10 agencies involved in the development of Inspire, and the agencies who have shown great leadership on the development of these indicators are UNICEF and Together for Girls. And so this really is a collaborative effort that different members of the Inspire working group can take on at various moments in time. Alex, over to you.
Yeah, just on the indicators, in order to track how well Inspire is doing, we've included 3 groups of indicators. One set of indicators asks about whether in the past 12 months a child has experienced a particular type of violence, for instance, being bullied at school, or whether parents have engaged, for instance, in physically violent discipline with their children. And that is a way of monitoring the outcome that we want to look at. The second group of indicators have to do with awareness, for instance, awareness of norms, of laws that forbid corporal punishment, or attitudinal support for nonviolent physical or nonviolent discipline of children. And then the third group of indicators has to do with asking target groups whether they actually received the intervention. So, for instance, in relation to life skills education through schools-based programs, asking what proportion of children in schools within a district that have been targeted for this actually say they received the life skills education in the past 12 months. So we tried to systematically address each strategy in that way, so that at a district level, you could put together a before, during, and after survey, which inquires about those measures.
Thanks, Alex. The next question is from Jeffrey Bradley, and he asks, does the WHO plan on doing an awareness campaign on this well-done and evidence-based inspired document? We need this to get into the hands of top leaders in government to be able to support it and invest in it. That is a great question. Yep, go ahead, Alex.
Yes. Well, we will most certainly be working very hard to make sure that everybody who needs to know about this does know about it, and that everybody who has to have it in their hands, on their desk, on their laptop, has it there. But it's certainly not WHO by itself that is going to be able to do this. It's going to be WHO and everybody on the call. And in particular, it's going to be WHO working very closely with CPC to help us coordinate this collective effort. And maybe, Mark, I can ask you to comment a little bit more on the early plans we have for dissemination and getting this out there.
So one connection that the CPC also has is to the CSO Forum, or the Civil Society Organization Forum of the Global Partnership. And we have already solicited expressions of interest from members of that, but we would extend the same invitation to all of you who are on the call, or anybody who happens to listen to this webinar on YouTube later, to please be in touch if you want to engage in Inspire in some way. What we know is that organizations are very excited about this. Beth and I recently had the opportunity to travel to Indonesia working on related but not Inspire specific work, and learned that the Alliance for CSOs to End Violence Against Children in Indonesia is planning on training people on the Inspire package. So we just want to know about things that are happening like that, and also we will be developing over the course of 2018. Sabine mentioned that the 2 tools should be ready by February, and starting in January, we'll also be working with the CSO Forum and anybody who's very interested in this to develop the outreach and the engagement strategy. We know that people are beginning to hear about Inspire, but that we have a lot of work to do. The focus has really been on getting the implementation guidance developed, and although that has been consultative, there hasn't been a lot of outreach. This is our first webinar on the topic. I've also mentioned that we're planning on doing some consultative webinars with the humanitarian community through both the Alliance for Child Protection and Humanitarian Action and the Child Protection Area of Responsibility of the UN Cluster System. But it really is an open and collaborative process, so please do not hesitate to be in touch. We've got Sabine's email up there right now, and she is a coordinator par excellence. She will make sure that anything you send her will get into the hands of the group or the entity that's most likely to use it. One other...
Mark?
Yep.
Sorry, Mark, maybe just before we move to another question, I just want to add that in terms of the government, we are working very much to make sure that national strategies are aligning to the Inspire strategies, and that they're evidence-based and that they're evidence-informed. So at government level, that's a huge piece of work, and it's really about getting the message out there. I once heard somebody say that Inspire is the vaccination for violence against children, and I really see it that way. It's about getting that whole prevention side in and making sure that we're all speaking the same language. I think for tuberculosis or polio, you have one medication, and we need to all start using that same medication, because if we keep on detracting and using other different strategies and interventions, then we're not going to move the sector forward. So we're using Inspire as the core of our of the partnerships work, and making sure that governments are using that as well.
And I do want to add one more point on that. I think that's a point very well taken, Sabine. Yes, it's the vaccination, but we also need to know that it can improve. And so you've mentioned, and Alex has mentioned, that we can continue to evaluate programs that may show promise. And so I think continuing to develop the evidence base is going to be a key piece of this. But also, we've spoken a lot about governments and have mentioned how CSOs can get involved in engagement. But as somebody who comes from a programmatic background at really a very micro level, you know, I oversaw programs in specific regions for international NGOs. I think this would be a very useful tool. I think if you are running parenting programs, the way that you can use Inspire, in addition to your strategic planning and your connection to national or district strategies, is to really read what's in the implementation handbook and what's in Inspire, and look at what they're doing and compare it to your own work, and figure out how you might be able to align your program with the programs that have been demonstrated to be evidence-based. Because within the rubric of a parenting program are many different approaches. And so reading about the ones that have taken the time and invested the resources to demonstrate their impact in a very demonstrable way, I think is very core learning in and of itself. I know that Alex mentioned the Parenting for Lifelong Health, and they actually have guidance for how an agency who wants to use this approach can do it. That's really what this operational guidance that will be ready in the next month or two will do, is to go in each approach and describe what are key considerations that you need to take into account as you design or redesign your program, what the different human resource and cost implications. So there's already a level of detail in the Inspire document available on the link that we're showing here. And then in a couple of months with the operational guidance, there will be additional detail that I think will be useful from the micro level all the way up to the policymaker level.
Thanks. So we have a question from Dorcas Kiplagat, who asked, do we already have the Inspire tool online? And that might be something that many of you are wondering. So the Inspire strategy document is already available online that outlines the 7 basic strategies and the evidence that is underlying those 7 strategies, and the implementation handbook, which does provide the more operational guidance that we talked about towards the end of the presentation, will certainly also be available publicly online once it is finalized in the next few months, and it will be translated into several languages as well. So I sent a link in the questions box with where the strategy document is posted. If you just Google WHO Inspire violence or some combination of those terms, you should be able to get to the link, and we can send that around as well if you can't find it on the webinar.
It's the link being shown right now.
Oh, right. That's correct. And Hani Hani Mansourian from the Alliance for Child Protection says, so glad to see the emphasis on prevention. How are you planning to show prevention works in reducing violence? Are the surveys representative and able to reliably show reduction in prevalence of violence? So Honey, I think that we spoke to this a bit when we were talking about the indicators, as we said that we're going to be releasing a list of indicators that are recommended for monitoring this program, and how those indicators are used, depends on what your research question or what you're monitoring, what you're interested in monitoring. So in some cases, you might want to collect those in a representative manner, but if you are focusing your program on a specific region, you wouldn't need a nationally representative survey to monitor the program if you're implementing it in a single district or a single region. So then you would monitor it. You would monitor based on the population that you are targeting for your program. And so are the surveys representative and able to reliably show reduction in prevalence of violence? So, the programs that are being recommended all have in other contexts reliably shown reductions in prevalence of violence. And whether that translates perfectly to other contexts does depend on what we're going to be monitoring. So the reason these programs are being recommended is because they have reliably shown reduction in prevalence of violence in other places, and we are recommending that monitoring continue to take place to make sure that with the modifications that will undoubtedly occur as these programs are modified for different contexts, that you continue to see those reductions in prevalence of violence with these slightly modified programs. Do others want to add to that? Hello?
I think you gave the perfect answer. Thank you.
Thanks, Alex. I think we've got just one more question right now from Lucy Steinens, who said, can you organize an interest group, listserv, Facebook group, or something similar for folks who want regular updates and also may have questions? So we do have a listserv called the Inspire Implementation Working Group, and it would be possible to join that working group. If you send me an email, I can add you to that list or send it to Sabine, and whose email is posted, and we'll make sure that you get on that list. In terms of a Facebook group, I think that those are all fantastic ideas for this next kind of dissemination stage that's going to happen after the implementation book the implementation handbook is launched, and those are certainly ideas that we are open to, and I think all of our organizations do use social media platforms for communication as is, so it's just a matter of creating a specific stream for Inspire. Others want to add to that?
No, I think it's spot on. We're having discussions about whether we should create this community of practice and who it would be for and how it would function. But I think we need to see what the demand is before we start giving the supply.
I'm not seeing other questions. Does anyone have any further questions? If not, and you think of something later, please do email us. We are always available and excited to talk about this topic.
Thank you, Beth. And I am happy to report that we're going to finish right around within the hour. Thanks to everyone. Lucy, we're going to consider you the next member of the Inspire working group, so you can look out for an email about that. For those who are members of the Inspire working group, there will be a presentation of the implementation handbook draft in a couple of weeks, so you will see an email about that. In the meantime, please do email Sabine at the address shown here if you would like to become a member. A big thank you to everyone. I think this is a baby step on our way to making sure that the world knows about Inspire, and I'm glad to see a question from Hani and to all other questions about how to engage more and connect more with the humanitarian community, which is something that we very much have on our minds. With no further ado, I think we will wrap it up here. Thank everyone for your time and your interest. Thank you to Alex, Sabine, and Beth for all of your thoughtfulness around presenting this. And it's a really exciting step to have this streamlined, organized presentation in Inspire, and I think on the webinar as well, of how organizations, governments, and coalitions can really act together to prevent violence against children and to reduce it. So a big thanks to you all, and this is the first or second step of many. Have a great
Thank you, Mark, and thanks to everybody.
Yeah, thanks everybody.
Thank you. Bye-bye.
Bye.